Every single week in my clinic, I hear the same question asked in different ways. Men lean forward, lower their voices, and ask, "Doc, what about those pills? You know, the ones they advertise everywhere? Do they actually work?" And every single week, I give them the truth, the same truth the billion-dollar supplement industry absolutely doesn't want you to hear. Today, I'm pulling back the curtain on male enhancement supplements. What genuinely helps, what's completely worthless, what could actually harm you, and what's just draining your wallet while doing nothing. No marketing spin, no corporate interests. Just honest medical facts. Before we go any further, do me a favor, hit that like button right now. And drop a comment telling me where you're watching from. Because what I'm about to share might save you hundreds or even thousands of dollars, and more importantly, it could protect your health. Let me start by explaining something most men don't realize. The phrase male enhancement is intentionally vague. It's clever marketing designed to promise everything while guaranteeing absolutely nothing specific. My name is Dr. Jocelyn. I've spent 5 years as a urologist working directly with men, reviewing these products, analyzing clinical research, and treating complications from supplements gone wrong. And here's what I need you to understand. The overwhelming majority of these products are either completely ineffective, wildly overpriced, or genuinely dangerous. But here's the important part, not every single one. There are a few ingredients backed by legitimate scientific research that can support circulation, hormone balance, and overall male wellness. The challenge is cutting through the marketing noise to find what actually has evidence behind it. The biggest lie the industry tells you is that pills can permanently increase size or magically restore function, regardless of what's actually going on in your body. That's simply not how human biology works. Here's the medical reality. Certain supplements can support healthy function by improving blood flow, reducing inflammation, or providing nutrients your system needs. But they cannot override cardiovascular disease. They cannot fix significant hormonal imbalances on their own. And they absolutely cannot change your anatomy. There's another dangerous myth I need to address. It's natural, so it must be safe. This is categorically false. Many of these supplements contain hidden pharmaceutical ingredients, dangerous herb combinations, or dosages that can cause serious medical emergencies. The FDA has issued warning after warning about contaminated supplements in this category. Some contain actual prescription medications that aren't disclosed anywhere on the label. That's not just misleading, it's medically dangerous and illegal. In my 5 years of practice, I've watched men waste thousands of dollars on products that did absolutely nothing. And I've treated men who ended up in my emergency room because of harmful ingredients hidden in supposedly all-natural products. So here's what we're doing today. I'm walking you through 5 categories of ingredients commonly found in male enhancement supplements. I'm telling you what the research actually shows, what's overhyped nonsense, and what could potentially harm you. Then, I'm giving you my professional recommendations for evidence-based supplements that might genuinely help, and the red flags that tell you a product is a complete scam. And if you stay with me until the end, I'm revealing the one category of supplements I consider genuinely dangerous and believe should be avoided entirely. Now let me break down 5 categories of ingredients you'll find in these pills, and I'll tell you exactly what the science actually says about each one. And if you want honest, unbiased medical information that could save you money and protect your health, hit that subscribe button right now. Number 5, L-arginine and L-citrulline. These are amino acids, building blocks of protein that your body converts into something called nitric oxide. Nitric oxide is the molecule that relaxes blood vessels and improves circulation throughout your body, including to the areas we're discussing. Multiple clinical studies demonstrate that L-citrulline, specifically, can improve circulation and support healthy function in men experiencing mild to moderate concerns. L-arginine has more mixed results in the research. Some studies show benefit, others show minimal effect. The effective dosage for L-citrulline, based on research, is typically 1,500 to 2,000 milligrams daily. For L-arginine, studies use 3,000 to 5,000 milligrams daily. My honest medical opinion, L-citrulline is actually one of the few ingredients I recommend to my patients, especially when combined with lifestyle improvements like better diet and regular exercise. It's safe when used appropriately, well-researched in clinical trials, and effective for many men. L-arginine is less reliable based on the evidence, but it's not harmful at appropriate doses. Here's the problem with most supplements on the market. Many products contain only 200 to 300 milligrams of these ingredients, far below the effective dose shown in research, and then they charge you $60 a bottle for it. You're essentially paying for pixie dust at that concentration. You're much better off buying pure L-citrulline powder from a reputable source for a fraction of the cost and actually taking an effective dose. Let me tell you why this matters emotionally. It's empowering to know there's an evidence-based supplement with real research behind it that actually supports healthy circulation. You're not just hoping you're using something with scientific backing. Practically speaking, if you want to try this approach, purchase pharmaceutical-grade L-citrulline from a trusted source, take 1,500 to 2,000 milligrams daily consistently, and give it 4 to 6 weeks before expecting to notice results. This isn't an overnight solution. I had a patient a few months ago who started taking L-citrulline while also improving his diet and starting regular walking. 3 months later, he came back and said, "Dr. Jocelyn, I'm genuinely noticing real improvement." Not magic, but real, consistent improvement. That's the power of combining evidence-based supplements with healthy lifestyle changes. Number 4, horny goat weed, also known as epimedium. This is one of the most common ingredients you'll find in male enhancement supplements, and it's been used in traditional Chinese medicine for centuries. The active compound in this herb is called icariin, and it has been shown in some laboratory studies to have mild effects similar to a class of prescription medications called PDE5 inhibitors. However, and this is crucial, the human research is extremely limited, and the effects are substantially weaker than prescription options. Animal studies show some potential promise. Human studies are sparse and show modest effects at best. My honest medical opinion: this falls into the might help a little bit, probably won't hurt category. It's not a miracle ingredient by any stretch, but it's also not dangerous when used appropriately at reasonable doses. The real problem is that most supplements don't contain standardized extracts, which means you have absolutely no idea how much active ingredient you're actually getting in each dose. It could be a lot. It could be almost nothing. You simply don't know. Here's the emotional reality. The exotic name and traditional use create an expectation that often significantly exceeds what the ingredient can actually deliver. That gap between expectation and reality leads to disappointment. Practically speaking, if you want to try this ingredient, look for a standardized extract with at least 10 to 20% icariin content. Take it consistently for at least 8 weeks, because if there's any effect, it builds gradually. And don't expect dramatic, life-changing results. I've had patients who genuinely believe it helps them. I've had others who noticed absolutely nothing. The research suggests the truth is somewhere in the middle. Modest benefit for some people, placebo effect for others. Number 3, ginseng. Specifically Korean red ginseng. Ginseng is another traditional herb that's been extensively studied in clinical research for male health. Multiple studies, including some well-designed clinical trials, show that Korean red ginseng can improve function in men dealing with mild to moderate concerns. A comprehensive analysis of multiple studies published in the British Journal of Clinical Pharmacology found statistically significant improvements across studies. The effective dose appears to be around 900 milligrams 3 times daily of standardized extract, which is important because not all ginseng products are created equal. My honest medical opinion, this is one of the better researched herbal supplements available. It's not as immediately effective as prescription medications, but it has legitimate scientific evidence supporting its use. Beyond male health, ginseng also has other documented health benefits. It may support energy levels, immune system function, and cognitive performance. So you're potentially getting multiple benefits. The important caution: ginseng can interact with blood-thinning medications and blood pressure medications. It can also cause insomnia or restlessness if taken too late in the day, which is something many men don't realize. Here's why this matters emotionally. It's genuinely reassuring to use a supplement that has actual peer-reviewed research backing it up, not just marketing testimonials. You're making an informed choice based on evidence. Practically speaking, if you want to try ginseng, purchase a reputable brand with standardized ginsenoside content. That's the active compound. Take it in the morning and early afternoon to avoid potential sleep disruption in the evening. I've recommended Korean red ginseng to patients who want to explore a natural approach before considering prescription medications. Some have had genuinely good results. It's not magic, and it doesn't work for everyone, but it's a legitimate option with real research. Number 2, yohimbine, derived from yohimbe bark. This ingredient is derived from the bark of an African tree, and it's one of the most controversial ingredients in male enhancement supplements. Yohimbine has actually been studied fairly extensively in clinical research, and it does have some evidence of effectiveness, particularly for concerns that have a psychological component rather than being purely physical issues. However, and this is critically important, it also has significant side effects: anxiety, elevated heart rate, high blood pressure, insomnia, and in rare but serious cases, more severe cardiovascular events. My honest medical opinion: this is where I become very cautious as a physician. Yohimbine can have some effect, but the risk-benefit ratio is not favorable for most men, especially men over 50 or 60 who are more likely to have underlying cardiovascular concerns. The additional problem is that many supplements contain unlabeled or inconsistent amounts of yohimbine, making it virtually impossible to dose safely. One capsule might have a little, the next might have a lot. You're gambling. Here's the emotional reality: the potential side effects, anxiety, jitteriness, racing heart, can actually worsen performance anxiety, not improve it. You end up feeling worse, not better. Practically speaking, I generally do not recommend yohimbine to my patients, especially older men or anyone with cardiovascular concerns. The risks significantly outweigh the modest potential benefits, and there are much safer alternatives available. If you're currently taking a supplement that contains yohimbine and you're experiencing anxiety, rapid heart rate, or sleep disturbances, that ingredient is very likely the cause. Number 1, proprietary blends with undisclosed ingredients. This is the category that concerns me most as a physician, and unfortunately, it's extremely common in the male enhancement supplement industry. The FDA has tested hundreds of male enhancement supplements over the years and found that a shocking percentage, sometimes over 50%, contain undisclosed pharmaceutical ingredients, including prescription medications like sildenafil, tadalafil, or chemically similar compounds. These are actual prescription drugs being secretly added to supposedly herbal supplements without being listed anywhere on the label. My honest medical opinion: this is dangerous, deceptive, and illegal. When you take these supplements, you have no idea what dose you're actually getting. You don't know if it will dangerously interact with your other medications, and you're completely bypassing the medical supervision that's required for prescription drugs for very good safety reasons. I've personally treated men who ended up in the emergency room with dangerously low blood pressure because they were unknowingly taking a supplement contaminated with prescription drugs while also taking nitrates for heart disease, a combination that can be fatal. Here's the emotional truth: it's infuriating that companies prioritize profit over consumer safety and deliberately deceive people this way. You deserve better than that. Practically speaking, avoid any supplement that lists a proprietary blend without disclosing specific ingredient amounts. Avoid products making outrageous claims. Avoid anything sold through spam emails, pop-up ads, or sketchy websites. If a supplement promises instant, dramatic results or seems too good to be true, it's either contaminated with undisclosed drugs or it's a complete scam, period. Now, here's the category I consider genuinely dangerous. It's what I call gas station or convenience store supplements, with aggressive marketing products with names like Rhino, Black Panther, Stiff Nights, and countless others with similar flashy packaging. These are the products that come in eye-catching, often metallic packaging, promise instant results, and are sold in convenience stores, gas stations, or online with no reputable distributor or company information. The FDA has specifically issued warnings about many of these products because they consistently test positive for undisclosed pharmaceutical ingredients, often in dangerous or completely unpredictable doses. Here's why this is so medically dangerous. Number 1, you're taking prescription drugs without any medical supervision whatsoever. Number 2, the dose is completely unknown and inconsistent from capsule to capsule. Number 3, if you're taking medications for heart disease, blood pressure, diabetes, or other conditions, the interaction could be life-threatening. Number 4, many of these products contain banned substances or dangerous adulterants that have been removed from the market for safety reasons. I've had patients end up in the hospital specifically because of these products. One man had a heart attack, another had a stroke. These aren't scare tactics or exaggerations. This is real, and it happened in my practice. If you're using these products, I'm asking you directly, please stop. They're not worth the risk to your life. So here's what I actually recommend. If you want to try supplements to support male health, here's my honest professional guidance. First and most importantly, address lifestyle factors first. No supplement can override poor diet, lack of physical activity, inadequate sleep, chronic stress, or smoking. Fix those foundational issues first, because they matter more than any pill. Second, if you want to try supplements after addressing lifestyle, stick to evidence-based ingredients with actual research. L-citrulline at 1,500 to 2,000 milligrams daily, Korean red ginseng at 900 milligrams, 3 times daily, vitamin D if you're deficient, get blood work first to know your levels, potentially saw palmetto for prostate health support. Third, buy only from reputable companies that use independent third-party testing. Look for certifications from USP, NSF, or Consumer Lab on the label. Fourth, give supplements adequate time, at least 4 to 6 weeks of consistent daily use before expecting to notice any results. They don't work overnight. Fifth, if supplements aren't helping after a reasonable trial period, see your doctor. There may be underlying health conditions that need proper medical evaluation and treatment. And most importantly, be skeptical of marketing claims. If something sounds too good to be true, it absolutely is. I need you to understand something. There's no shame whatsoever in wanting to improve your health and function. That's completely normal and healthy. It shows you care about your quality of life. But you deserve honest information, not deceptive marketing designed to exploit your concerns. You deserve to know what actually works based on evidence and what's just expensive placebo or worse, genuinely dangerous. You don't need to fall for scams or risk your health with unregulated products sold by companies that don't care about your well-being. There are legitimate, evidence-based approaches, both natural and medical, that can genuinely help when used appropriately. Hit that like button if this video gave you honest medical information the supplement industry absolutely doesn't want you to have. Share this video with another man in your life who needs to hear the truth about these products. Help me spread honest information. Subscribe to this channel if you haven't already. I'm here to cut through the marketing hype and give you evidence-based information you can actually trust to make informed decisions about your health. And remember, your health is too important to gamble on unregulated supplements making false promises. There are real, effective solutions available, both lifestyle-based and medical. Work with your doctor. Make informed decisions based on evidence. Protect your health because you only get one body. You deserve honesty. You deserve safety. And you deserve solutions that actually work based on real science, not marketing. I'll see you in the next video. Take care of yourself because you're absolutely worth it.